the tender points. So if you were to have a client and their pain was moving all over the place, would that be something that you'd be then thinking about?
Absolutely. I think that's part of every chiropractic exam would be to take a look and see where they are having their pain. But again, those tender points, they're very pronounced in people with fibromyalgia.
Yeah, exactly. You just go near them and you just
absolutely.
touch and then,
You know, for some of us, you would think it's almost laughable. You put a little bit of your finger pressure and they're ready to jump off the table.
Exactly.
But again, it's devastating. And again, fibromyalgia is devastating in the fact that, it affects, not only them, but their whole family. So, what we try to do within the chiropractic profession and really all the practitioners that deal with fibromyalgic patients is to offer them some hope and try to give them, some venue to help with controlling their discomfort.
Yeah, absolutely. So for people who might not know, sometimes it can take up to 5 years for people to actually get diagnosed with fibromyalgia. And in order for them to be properly diagnosed, they'll really go through a whole battery of all other tests to rule out everything else. And then it comes back to the tender points. It comes back to 11 out of the 18 tender points being positive.
Yeah, absolutely. And that's one thing that's very important, for those, I'm sure Dr. Hyde could even elaborate on that a little bit more.
Sure.
But, people with fibromyalgia have gone and seen tons of different doctors about this.
And that can be very frustrating.
Oh, absolutely.
So you do a lot of work with accidents as well. And as we spoke of before, sometimes an accident can be a preceding factor. What's different about somebody who has an accident? How do you approach them differently with respect to the pain model?
Well, the thing is that people that have these accidents generally are in just excruciating pain, right? So what we have to do is we have to start slow and work our way up. And that's the thing, is a lot of times if we try to go a little bit too far too fast, these people just tend to regress a little bit.
Sure.
So I guess the key thing there is to have consistent progress and not overwhelm the people.
Exactly. Some people are a little afraid of chiropractic. Can you help us feel more comfortable with it? Some people think, oh, that high velocity quick thrust, I'm a little bit afraid of it. What words would you say to those individuals?
Well, I think a lot of people that are, there's different types of chiropractors and different types of chiropractic techniques. The thing is that I think a good chiropractor has a lot of different techniques in his toolbox. So for those that are struggling or are having a lot of pain, what we do is we use a very low force technique like the activator or myofascial technique or active release.
Let's talk about that. What exactly is the activator for our audience?
Well, an activator, it's an instrument, and when people generally go see a chiropractor, what we do is we have when we do the adjustment and we mobilize the spine, there's a lot of force over a pretty significant surface area. With the activator, what tends to happen is a very reproducible force over a very small surface area. It doesn't hurt, you don't hear the big crack, but it does actually have the same benefits as the manual adjustment.
Yeah, it actually moves the joint through its natural range of motion and you actually get that therapeutic benefit.
Absolutely. It's funny, I've seen it on video fluoroscopy, and I think that's kind of neat. It's kind of like a walking x-ray. And to see the joint actually move with the activator, it's pretty awesome to see.
Yeah, because it's a very small tool that people,
absolutely.
Yeah. Okay, so you've got lots of tools, and I think something too that people might not understand is a chiropractor is a holistic practitioner. So when somebody walks in, yes, they might have pain, but what are some of the other things going through your mind when someone walks in?
Well, it's funny, when people come in with that kind of pain, we also want to address maybe the psychological aspects of the pain.
Like the stress component of
absolutely,
things. Yeah. How much do you think stress is really related to fibromyalgia conditions?
Well, I think like with anyone getting in a car accident or fibromyalgia, there's a lot of stress involved in being in pain, and I totally understand when you're hurting all the time that depression will start to creep in and that loss of hope. But again, I think a good practitioner, what they try to do is they try to offer a little bit more hope to these patients, and in doing so, if that even can improve their outlook and their desire to be again more proactive and keep on going, well, that's kind of mission accomplished.
Exactly. I think it's important for people with fibromyalgia to help pace themselves, and I was doing some researching and I found actually an app and it's called Pain Tracker. So if somebody's out there and you're experiencing pain, it was interesting because 40% of people who used the application had low back pain, which ring ring, chiropractor, and about 38% had fibromyalgia. So you can see the significance, because back pain is the #1 thing, but fibromyalgia really falls in quite closely. So what this application would do is you would just basically track your pain, your medications. You could bring it into your practitioner. Your practitioner would help you sort through it and then just tailor their treatment. The other thing we want to make sure people understand is that if you are receiving treatment, especially if you have fibromyalgia, that if it gets worse with the treatment, don't just stop going. What do you recommend to your patients?
Well, we want to make sure that, first of all, it's pretty normal to feel a little bit worse at the beginning.
Yeah, a little bit more tender.
But if you have open communication with your practitioner, this is something that they should be addressing. And then again, with their toolbox of different techniques, what they can do is they can tailor their adjusting techniques or the way that they are going to be proceeding with your care.
Exactly.
To alleviate some of that discomfort.
Thank you. It was a pleasure to have you here, and you're going to be joining us again. So coming up next, what are some natural treatment options? Stay with us. We'll be back in a few minutes on Revive Life.
Sure.
We didn't cover the similar diet. Welcome back to Revive Life. I'm naturopathic Dr. Joelle, exploring fibromyalgia. We've spoken about the common symptoms, with the predominant complaint being pain. Natural enzymes in foods help to reduce inflammation and chiropractic care. Fibromyalgia can be triggered or linked to a hormone imbalance. Increased pain, headache, fatigue, bloating, anxiety, and insomnia are all symptoms actually of low progesterone and high estrogen. So I encourage you to have your hormones checked. In addition, the adrenal gland can also be associated with fibromyalgia. Of course, the adrenal gland is the major stress organ in the body, or it responds, and it produces hormones, epinephrine, norepinephrine, cortisol, DHEA, and there's some specialists that actually believe that there's an imbalance in DHEA, which can contribute to the problem. So again, make sure you speak to your specialist to find out your specific relationship in your health condition. We're back now with Dr. Hyde, our expert in fibromyalgia, chronic fatigue syndrome, and ME, and we also have Dr. Byron Watson, who's a chiropractic doctor. So we're just now continuing our discussion, and where we left off is we were talking about motor vehicle accidents, and we had an interesting conversation. So perhaps you can just sort of elaborate. So you, of course, deal with a lot of motor vehicle accidents. And
yeah, well, in my chiropractic practice, I see a lot of car accidents. And my question to Dr. Hyde was, is there a link between, say, post-traumatic onset fibromyalgia and the car accident?
Mm-hmm.
I think this is an excellent question. There's two kinds of trauma. First of all, there's trauma to the head. When you look at patients who've had serious trauma or repeated minor trauma to the head, you develop all sorts of fibromyalgia and other pain situations and all sorts of other diseases associated. So the history of the patient is really important, as you pointed out. And one of the first things you have to have is a history, and have you had a previous significant head injury? Mm-hmm. And this tips you off. And that's one thing. The second area that we were mentioning before is one of the first things that happen when a patient or an individual has a motor vehicle accident. They're not used to having pain. In the old days, they'd go and they'd take an aspirin. Mm-hmm. Today, they go to the doctor for a miracle drug, and the doctor's got many miracle drugs. And so the first thing the doctor will say is, well, we're going to put you on a non-steroidal anti-arthritic medication. Mm-hmm. And that usually immediately takes the pain away. But then it starts to come back after a week or two, and the doctor then will increase the dosage and sometimes change the medication. And over a period of weeks or months even, the patient persists on this kind of medication. That kind of medication can cause fibromyalgia.
So medication can cause fibromyalgia?
Absolutely.
Yeah.
And the patient may, for instance, injure a shoulder, and you start treating the shoulder with an NSAID, an a non-steroidal anti-arthritic medication. And before long, the pain isn't in the shoulder, it's over in the entire body. You've got classic fibromyalgia. Mm-hmm. And that was one of the things we talked about. Mm-hmm. And another thing that we talked about was statins.
That's right.
Statins are the biggest single money-earning drug for pharmaceutical companies in the world.
Sure.
I think
How
there's
many millions
something,
of people are
it's
using
like
them?
billions and billions
Mm-hmm.
of dollars are spent on statins. 5% of normal people, maybe 10% on statins, get muscle meltdown, and you get pain all over the body. 50% of fibromyalgia syndrome people or ME patients will develop muscle meltdown or serious muscle pain from them. So if you know that, all you have to do, well, there's a simple test, and this simple test will show creatine kinase, CK. Mm-hmm. You just do that test, and if it's elevated, you know it's the medication induced. So yes. You've got a great way of checking the patient and removing the medication,
now,
and they tend to get better.
Though, because when we test for CK with athletes, I often see it being high too. So how do you differentiate if somebody has athletic pain from overexertion versus the fibromyalgia type pain?
Well, once again, if you've got a sports person that are running all out or in professional football like yourself, then that's rather obvious from the start that you're going to have an elevated CK. Mm-hmm. But I'm talking about the average couch potato, the guy that's working in the federal government or provincial government office all day long, doing a bit of skiing on the weekend, playing touch football with their kids. They're not going to have sports-related elevated SK.
Sure.
Most people do not. But on statins, those that do, you know you're in trouble with that statin.
Okay, so we have the car accident or the accident, then we have the medication, which amplifies it even more. There's also the concept of fibromyalgia versus chronic fatigue syndrome. We see a lot of that in our office. Then we have ME. What's the difference between all of those, or are they really the same?
Well, the Americans think they're the same. I think they're very different.
Those Americans.
My diagnosis is very simple. ME has occurred in over 60 epidemics worldwide. When it occurs, there's an acute onset. The incubation period is 3, 4, 5 days. It's short. Most of them are caused by a polio group virus that still exists. Coxsackie echoes, they're within 1% identical to polio 1, 2, and 3, which is the only thing in the immunization. When you look at these patients with that have had this kind of injury, almost invariably when you do a brain SPECT, not an MRI or a PET, you do a brain SPECT. This is a physiological assessment of the brain. They have spotty injury all over the brain. And those are the ME people.
Would that be similar to what we might see for somebody who've had multiple concussions?
Absolutely.
Yes. Okay, because I know that there's a company now, because my son, he had 3 falls this winter with skiing. And you know, he's a good skier, but he had 3 falls, and they weren't concussions, but of course we started being concerned. And I know that there's a company now that actually creates a apparatus that you can actually plant on a individual's helmet, and it can actually measure the potential risk of concussion. And I know that company's called Impact, and they're just here locally in Ottawa. So you're saying that this could be very similar to the injuries that we're seeing there?
Oh, it's the same. And there's a very good point that you've raised, and that is, if you have a bullet in your head, or if you've had a stroke and you go to a neurologist and they tap on your knees and they check you with the knee